appreciate that you're testifying here before us. Let me just make it very clear. The goal of all of us on this side of the panel, and I'm assuming on both sides, is to keep schools open even in the next pandemic by equipping them with the tools and the protocols and all of the equipment necessary in order to help reduce transmission, as well as keeping our students, the teachers, the nurses, and everybody safe. And that should be the goal of this committee, is to figure out how do we make our schools resilient. As chair of the Congressional Hispanic Caucus, we dove deep into the disparities of school closures and how it affected African Americans, Latinos, Native Americans more than others. And the reason why we saw this disparity is because of the underlying inequities and disparities that we see in our healthcare system to begin with. Public schools and schools where you have African Americans, Latinos are overcrowded compared to private and Catholic schools. They are underfunded compared to private and Catholic schools. And in those communities, those workers live in overcrowded housing. So the risk of increased transmission, as borne out by the data in African American and Latino communities, was much higher. So in a moment where we didn't have the vaccine or the healthcare tools that we needed, there was reason to practice more social distancing in those schools. And schools that had an abundance of funding were able to quickly bring their students back. They were able to comply with some of the guidelines and had the equipment necessary. And then you see the cycle of disparities and inequities that we see not just in the healthcare system, but also in our educational system, which combined that saw a higher rate of mortality and morbidity due to this pandemic in Black and Latino students. That is why, and I must say that in the infrastructure law that we supported, in the Inflation Reduction Act that we supported, in the omnibus that we supported, there was equity built into the funding in order to address the public health schools and the communities that have historically been under-resourced for whatever reason, in order to prevent and stop this transmission and to protect the communities so they can have an equal playing foot in education and keeping their schools open and in having to build resilient communities to begin with. That was built in the piece of legislation to address the type of disparities that you're speaking of now. And that is a reason of many that when President Biden took office, his administration hit the ground running to get kids back in schools. The president knew kids belonged in schools to learn and grow, and he understood this understood that we needed to get kids back in school safely and responsibly, and open schools safely and responsibly, equipped with public health tools. That was crucial to putting our nation on firmer footing in its pandemic recovery. Within 1 year of President Biden taking office, the number of schools that were safely reopened were more than doubled to 95%. And thanks to the Biden administration's decisive action, more than 99% of America's schools remain fully open for in-person learning. Ms. Mazik, when President Biden took office in January 2021, just 46% of public elementary and middle schools were fully reopened for in-person learning. Is that correct?
That's the data I see.
And so prior to when President Biden took office, had the federal government provided the necessary guidelines, tools, and resources to facilitate kids' safe return to the classrooms?
There have been investments in bringing students into schools.
Before the Biden administration, or was it with the Biden administration taking office?
There were some CARES Act funds, and then there was the ESSER funds and other funds to provide in-person learning, because we know that in-person learning promotes overall student health and well-being.
And what was lacking at that time before President Biden that we needed to do in the American Rescue Plan?
Specifically, what was lacking around the health?
around the response to get our kids safely and responsibly back into schools.
Yeah. One of the issues that was concerning was the equipment, the supplies. PPE was in short supply. Healthcare does happen at schools, and to provide healthcare in schools, there was a need for equipment such as PPE, cleaning and disinfectant,
Okay.
and ventilation in schools.
So less than 1 month after President Biden ordered the Department of Education and HHS to develop these evidence-based guidance, the CDC issued comprehensive guidance for testing, maxing, and vaccination to support the safe return to in-person learning. Ms. Mazik, how do these resources bolster local policymakers and public health officials' efforts to reopen schools?
Well, with vaccination, there was an ability to protect the community. There were layered mitigation strategies that were available. As the novel coronavirus, we understood what it was doing, how to deal with it, especially from a point of mitigating factors, with vaccination being one of the first lines.
I thank the chairman for his grace. I just have one more question. What lessons can we learn from our response to the COVID-19 pandemic to minimize the impact of future pandemics on our nation's children?
Well, I believe that one of the lessons we learn is that keeping children in school is important. We know that that's important, and in order to do that, we need to bolster the supports that they need in order to be in school learning. They need health, public health. They need the supports from specialized instructional support personnel to help them be available for their learning.
I now recognize the chairman of the full committee, Mr. Comer from Kentucky, for 5 minutes of questions.
Thank you, Mr. Chairman. As the parent of 3 kids in the public school system,